Good morning, Miss Nettles. How are you feeling this morning? It's been a really hard week for you. Yes, I understand. I'm sorry. Your body is fighting so hard right now, and you need a little bit of extra help. The doctor wants to try and give your body another shot of fighting off this cancer and start you on a new medication to help increase your neutrophils, okay? The chemotherapy has really wiped a lot of those good fighting cells in your body that fight off infection and support your immune system, and we want to help you fight off all that bad stuff that invades your body, okay? This new medication is called Pegfiltrastim or Neulasta. So that's a whole lot easier to say, isn't it? Yes. Neulasta is a longer lasting version of its mother medication that we tried before called Pegfiltrastim, okay? But it only helps make more neutrophils in your body and not both white and white blood cells and neutrophils. But neutrophils are the most abundant leukocyte in your body. They are the first to arrive at any sign of inflammation or any trauma, and they are a granulocyte. And these have been really depleted during your chemo treatments, so we want to be able to increase those by starting on this medication, okay? This medication helps activate the cells that fight hard for you, and so there's going to be more of them. This medication helps make more of the neutrophils that fight in your body, okay? The granulocytes are the type of leukocyte or the white blood cell that have little granules in them that expel and eat and destroy all the bad things that may enter your body due to the chemotherapy, okay? All right, well, we can give you this medication just through a tiny injection subcutaneously, which is usually just in the belly, any fatty tissue. So we've got quite a bit of that to go. Yes, honey. We will get it done for you, but we do end up giving those most of the time in your belly through a small injection. And it actually is just needs to be given once a week because it does stay in your body for so long. It's got like a 17-hour half-life, so we just have to give it one time. Once a week, I'm sorry, not just one and done, but once a week. Now, there are just a few side effects with this medication, okay? You'll want to, and there's some life changes, not anything new that you have to do, but just I want you to continue doing these things. When we have leukopenia, which is your white blood cell counts have been really small. They've been, there's not enough of your white blood cells. That's what we call leukopenia. There are certain precautions that we want you to take. And so we want you to be very careful with your activities of daily living. We want you to keep good hygiene, and I still want you to avoid the fruits and vegetables and grains as they can introduce unwanted pathogens in your already suppressed immune system, okay? We want you to continue to avoid those people that are sick. And it is flu season, RSV is going around like crazy, and of course COVID is still happening. So try to keep your door shut. Use that cell phone, talk to as many people as you can, but just try not to come into face-to-face contact with any sick people, okay? Try to avoid those circumstances at any time because your white blood cell count is down and your neutrophil count's even lower. So we really want to give you the best shot and give your body the best shot at fighting all of this. Now, back to the side effects that I was telling you about. This medication could cause some bone pain since your white blood cells are made in your bone and your bone marrow is in your bones. So if we're trying to make something in the middle of your bones, so that's why people have bone pain, because you have medication being made in your bone, or the medication is doing the work inside of your bones. But do you have any questions for me? Sorry, that got a little confusing there for a second. Well, I really hope you start feeling better. We'll just give this, like I said, maybe have some bone pain, give this medication once a week, and try to stay out of contact. Do not get in contact with any sick people, all right? And I hope you feel better after your chemo treatments, and you have a wonderful day. And if there's any questions or concerns, I'll be right here all week to answer them for you, okay? All right. Thank you, Miss Nettles. We'll talk soon.